Thank you very much, Mr. Chair. I want to thank you for inviting us before the committee today. We are grateful for this opportunity to talk about our work in the health portfolio and our financial overview for Supplementary Estimates B for 2022-23. I'm accompanied today by Minister Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health, as well as you have mentioned, Dr. Stephen Lucas, Deputy Minister at Health Canada, Heather Jeffrey, Associate Deputy Minister, Health Canada, Dr. Supriya Sharma, Chief Medical Advisor, Health Canada, Dr. Harpreet Kochar, President of the Public Health Agency of Canada, Dr. Howard New, Deputy Chief Public Health Officer, Public Health Agency of Canada, Dr. Mike Strong, President, Canadian Institutes of Health Research, and Philippe Morel, Vice President, Operations, Canadian Food Inspection Agency.
Issue at hand. Our appearance here today also provides us the opportunity to share with you the latest information related to the shortages of children's and infants analgesics. Thanks to close collaboration with our industry partners, a record number of children's analgesics are currently being manufactured across the country, with some companies producing twice as many units as they did at the same time in 2021. As an example of this increased production, during the month of November only, a total of 1.1 million units of children's Advil products from Alon will have been made available for the Canadian market, which is a significant amount versus the typical November. This is obviously good news for Canadians. Children's pain medication is being produced in large numbers in Canada. This increased domestic supply is in addition to the importation of more than 1 million units announced last week, distribution of which is currently underway across Canada. An additional importation of around 500,000 units is scheduled for the next 3 weeks. As we continue to approve increased supply to community pharmacies and retailers, work continues to ensure pediatric hospitals are well stocked and in a position to manage the shortage. We're also looking to find longer-term solutions with provinces and territories, industry and stakeholders, such as pharmacies and children's hospitals, and we will continue to keep the committee apprised of the progress. Pour revenir au sujet d'aujourd'hui,
to come back to the matter at hand today, the Government of Canada continues to address the long-term effects of the pandemic of COVID-19, and as I mentioned earlier, our budgetary needs reflect this. At this time, we are seeking $3.4 billion on behalf of the health portfolio. Beginning with Health Canada, I am seeking an additional $1.9 billion. This funding will be used to address Canada's ongoing COVID-19 response as well as ongoing health care issues. It also includes funding to improve mental health supports and services, as well as funding to address the opioid overdose crisis and problematic substance use. My colleague, Minister Bennett, will have more to say about those two issues in a few moments.
Estimates B, PHAC is seeking an increase of $1.4 billion to its reference levels. This includes $118 million in new funding and $1.2 billion in reprofiles from 2021-2022. Through Supplementary Estimates B, the Canadian Institutes of Health Research are also seeking an increase of $106.1 million. This investment will help implement the important Clinical Trials Fund and provide funding to support the study of long-term health impacts of COVID-19 as well as other important initiatives.
And finally, CFIA, the Canadian Food Inspection Agency, will see an increase of $19.5 million. For the most part, this increase will help the CFIA respond to the impacts of COVID-19 in Canada's food production, supply chain, as well as the economic implications stemming from disruptions in employment.
Commitments, as set out in our Supplementary Estimates B, are a reflection of our most pressing health priorities. They demonstrate how we are taking action to protect and improve our health system for all Canadians. Merci. Thank you. Miigwech.
Thank you very much, Minister Duclos. Next, Minister Bennett, welcome to the committee. You have the floor.
Merci.
Thank you. I'm pleased to be here today to talk about certain investments that are being sought through Supplementary Estimates B. I would like to begin by highlighting that we are on the traditional territory today, the unceded territory of the Algonquin people, who are the stewards of this land.
And our colleagues from Health Canada and the Public Health Agency and from CIHR. Bien que le COVID-19
Although COVID-19 increased the number of people dealing with mental health problems, it also allowed quite a number of us to become more able to talk about our own mental health.
The stigma that remains a significant barrier to seeking care. Since 2015, we have made historic investments to support mental health and to deal with problematic substance use, including the $5 billion to the provinces and territories to increase the availability of mental health care, $598 million for a distinctions-based mental health and wellness strategy for Indigenous peoples, $270 million for Wellness Together portal, and $45 million to develop some national standards on the priorities articulated by the provinces and territories. $350 million in the substance use and addictions program since 2020, and many other targeted investments in substance use and mental health promotion innovation. The $5 billion investment through provincial and territorial bilateral agreements is currently providing $600 million of additional annual funding until 2027. I'm also pleased to say that the online portal Wellness Together Canada and its companion pocket app, Pocketwell, which have specific funding included in this Supplementary Estimates B, has assisted Canadians to get the help they need both directly and as a stepping stone to receive advice or where to find more specialized care. We know, sadly, when so many Canadians need support, that support is still all too often out of reach. There is much more that needs to be done, and among other further actions, we will continue to engage with provinces, territories, and stakeholders to invest additional funding through a mental health transfer. The Standard Council of Canada, together with our provincial and territorial partners, are also developing the national standards for evidence-based mental health and addiction services on the 6 priority areas identified with our provincial and territorial colleagues. We are particularly encouraged by the incredible early progress of national standards for integrated youth services. We welcome the CRTC's decision approving the new 988 three-digit suicide prevention line and are working to ensure it has the capacity for a very successful launch next fall. We want people to know if you are struggling with thoughts of suicide or know someone who is, please know that help is available right now at 1-833-456-4566. The toxic drug and overdose crisis continues to take a tragic toll on families, loved ones, and communities. Our government will use every tool at our disposal to work with our partners to end this national public health crisis. Since 2017, we have committed more than $800 million to address the overdose crisis, and we are taking concrete steps to divert people who use drugs away from the criminal justice system. This is a public health issue. Approving BC's decriminalization proposal for personal possession of small amounts of certain substances was an important step. And so far, we have also supported 27 projects supporting a safer supply of drugs. We must demonstrate to Canadians that we share their concerns and have been listening to those with lived and living experiences, the experts, and those on the front lines to put in place evidence-based actions to address the parallel pandemic of mental health as well as the tragic ongoing toxic drug and overdose crisis. Je me jouais d'approfondir.
I will be pleased to speak in more details about these issues when I respond to your thoughtful questions.
Thank you very much, Minister. We're now going to proceed with rounds of questions, beginning with Dr. Ellis for 6 minutes, please.
Well, thank you very much, Chair, and thank you to both ministers for being here and your officials as well. Certainly an important time for Canada with healthcare crisis that we have, not only in delivery of healthcare, but in mental health as well. So, again, thank you for being here. Minister Duclos, through you, Chair, if I may, the Prime Minister spoke very openly in the House of Commons about the 7,500 doctors, nurses, and nurse practitioners that $3.2 billion was going to bring to this country. And I guess the question is where have we spent that money, and how many of those doctors, nurses, and nurse practitioners in each of those specific areas are actually here working on the ground now?
Thank you, Dr. Ellis, and thank you, everyone. First, the statement of what we've done until now. As we know, COVID-19, although it's not over, it's better than it could have been, and that's because, in part, the federal government invested $72 billion to a large extent to support the safety and the health of Canadians. That is continuing through vaccination, rapid tests, and access to treatments like Paxlovid. Second is the additional $2 billion that was announced last budget to reduce the backlogs in surgeries, and that obviously comes through supporting health workers, nurses and doctors, hiring more of them, recruiting more of them, and retaining more of them. And finally, other measures which are supportive of the health workforce, including the $3 billion in long-term care, the $3 million in mental health care, and the $3 billion in support to home care and community care services.
Again, through you, that Minister, I guess the question was perhaps not clear. I didn't ask about COVID. I asked specifically about how many of the 7,500 doctors, nurses, nurse practitioners for $3.2 billion are actually working on the ground. The Prime Minister very clearly spoke about these numbers in the House of Commons. I know you were there. I was there. I heard him say it in person. That's the question to which I'm looking for an answer on behalf of all Canadians, and perhaps most specifically on behalf of the 100,000 Nova Scotians without access to primary care. So, sir, through you, Chair, if I may, please, the answer to how many of those actual health practitioners are on the ground.
And on that specific piece, we would certainly want to commend the efforts of provinces and territories, which in the past months, thanks in part the support of the federal government, have been able to repair the damage created by COVID-19 by recruiting more health workers, by training more of them, by retaining more of the nurses that otherwise would have left their profession. So the $2 billion I mentioned earlier, the increase in the CHT from $43 to $45 billion, the forthcoming additional increase in the CHT from 45 to 49, which is a 10% increase, that's all supportive of the efforts of provinces and territories to hire, recruit, and retain more of our healthcare workers.
Thank you, Minister. Through you, Chair, I guess that answer's not forthcoming, unfortunately. That being said, maybe I'll try something different. Wait times, an entirely different topic, incredibly important topic here in Canada. I've had an opportunity to meet with some of our orthopedic colleagues. There's not a healthcare shortage of orthopedic surgeons, I'm told, so they're able to perform these surgeries. Only $2 billion of the $6 billion available for wait time changes is now been deployed. We do know very clearly that folks who are waiting total joint arthroplasties often are not in work situations or creating difficulties for their families, the need for medications, etc. It would appear that that would be an easy deployment of more of those funds. Can you please tell me what the government's opportunity is going to be there around deploying the funds specifically for total joint arthroplasties?
That's a great question, and it points again to the $2 billion additional investment we provided to provinces and territories just a few weeks ago. So those $2 billion are currently invested by provinces and territories to reduce these very significant backlogs, as you said, in surgeries and diagnostics. That's in addition to the efforts, as you also pointed out, that provinces and territories are making to provide better access to family health teams, primary care, access to family doctors. That's key to making sure that people are prevented or don't have to go to the emergency department and to undertake difficult and expensive surgeries for things that could have been cared for and cured for if they had had access to, as you said, appropriate and accessible primary care and family health services.
Thank you, Minister. And through you, Chair, if I might, Canada Mental Health Transfers, we've heard about this in the platform of 2021 of the Liberal Party. None of that money was deployed in the budget of 2022. None of it was deployed in the fall fiscal update. Can you give us an update, sir? The country is wanting to know when this mental health crisis is going to be addressed, when the money is going to be deployed, and we still see that the finances are not being deployed out there. Canadians are hurting. They need to be served by this government. There's money out there that your government, sir, has committed. That money is not being deployed. The question that needs to be answered, of course, is when and why.
On the Canada Health Transfers, as I mentioned briefly earlier, it moved from 43 to 45 about 9 months ago, plus an additional $2 billion for backlogs in surgeries and treatments. It's going to increase to $49 billion in March 2023, which is an increase of 10%, then move up to 51 to 53 and 55. So over 4 years, an increase of about 25% already guaranteed. But the Prime Minister also pointed to the fact that we will be doing more. And because we need to, and we acknowledge we will be doing more, as you said, to acknowledge the fact that our health workers and patients are hurting across Canada.
Thank you, Minister. Next, Ms. Sidhu, who's participating virtually for the next 6 minutes. Go ahead, Ms. Sidhu.
Thank you, Mr. Chair. Thank you, Minister Duclos and Minister Bennett, and all the officials are appearing in the Health Committee today. My first question is to Minister Duclos. Minister, I see funding to support new National Women's Health Research, which is initiative to advance research in high priority areas. COVID-19 highlighted the importance of health research and innovation. Can you tell us the importance of investing in women's health research and what our government is doing?
Thank you very much, MP Sidhu. And not only do I appreciate that question, but I think my colleague Caroline also would appreciate that very much. CIHR is a key federal institution that supports not only research on diseases, but research in support of patients, families, caregivers. We have to speak of the diseases. More importantly, we want to speak of the importance of supporting those living with different diseases, and that includes mental disorders and all the things and all the impacts that these disorders and diseases have, as I said, on families and communities. So a total of $414 million invested in 965 research projects since March 2020, and many of them focus on COVID-19, but many others focus on the mental health and substance use support needs of Canadians across our country, and in particular through the difficult times that we've seen in the last 2 years and a half. So again, great level of support on the part of the federal government, but more importantly, immense efforts by researchers, scientists across the research community in Canada, which we not only want to, but need to celebrate on every possible occasion, including this one today.
Thank you, Minister. Minister, we know that there's a significant pressure on our health system right now. Chronic diseases like diabetes play a role. Investing in healthy eating and research can help ease those burdens. Can you tell us what you're doing to invest in research, prevention, and treatment?
Thank you, MP Sidhu. Sonia, again. Well, first, I think most people around this room would know of your significant work and your considerable success in moving forward with the framework for diabetes in Canada. We're grateful to you, but also to all the other partners, leaders, and experts that have supported that framework that we tabled on October 5th, just a few weeks ago. That framework is important, but is also complementary to other investments and efforts that we're making, including the release and the implementation of Canada's new food guide, which we know is key in helping Canadians eat healthily and live healthily. Just a few weeks ago, we also announced important food front of package nutrition labeling, which is going to be of great help to inform Canadians on the type of healthy food they might be able to purchase in grocery stores, and also to encourage the industry, the food industry, to reduce the level of sodium, sugar, and fat in the food that people rely on to live their lives. So again, MP Sidhu, Sonia, thank you for your leadership on that, and we're quite fortunate to be able to support that leadership.
Thank you, Minister. Minister, parents were concerned about the children's pain medication shortage. What type of steps being taken to increase our domestic manufacturing capacity for these critical medications?
Two things. First, due to the increased demand, and that's driven obviously by the terrible viruses that are impacting our children and our young children. In particular, demand for analgesics has increased dramatically over the last few weeks. Domestic production has also increased by about 100% in Canada over the last few weeks. That's good news, but to make sure that families and children have access to the appropriate medication at the appropriate time, we also approve of emergency importations of a large number of medicines and analgesics from outside of Canada, which are currently filling the shelves and the stocks of pharmacies, community pharmacies, and hospital pharmacies across our country.
Thank you. And final question to Minister Bennett. Mr. Bennett, do you believe one-stop approach will increase the likelihood that youth getting access to the most appropriate mental health or addiction support in the most appropriate and timely way? Can you expand on that?
Thank you so much for the question. And yesterday we had a very exciting announcement where we were able to demonstrate that all 13 jurisdictions have come together to understand that this model of integrated youth services that was led by the Foundry in British Columbia and the hubs here in Ontario, as well as L'Air Ouverte in Quebec, that the idea that you can get the most appropriate care by the most appropriate person, the most appropriate provider, place at the most appropriate time means that all of a sudden things like peer support, those with lived and living experience are able to make it feel safer for young people to come. They get primary care, they get a social worker or a psychologist or an addiction medicine person, but helping with their education, getting a job, housing, all in one place with an integrated record. But the exciting thing is that yesterday we were able to announce that the CAMH and CIHR will be not only working on these evidence-based models, but creating the evidence as we go to be able to demonstrate what works and what doesn't work. And so I think this is a huge leap forward in terms of how we actually deliver integrated services to Canadians instead of this sort of patchwork quilt of non-systems that were a huge challenge to youth in the past.
Thank you, Ms. Sidhu. Thank you, Minister Bennett.
Now we go to Mr. Garon for 6 minutes. Thank you, Mr. Chair. Ministers, welcome to the committee. I have a question for the Health Minister. To optimize the use of resources in health, the Quebec government has worked over the past 20 years, has carried out a number of reforms, the reform Rochon, the Garon reform, but We know that Quebec and the provinces have had problems optimizing the funding despite the transfers. Is that your position as well? Well, our position is based on the consultations that we've had with the various governments over the last several years. We've had 11 meetings over the last 4 years, and we all agree on the same priorities, the same vision. That means that we want people to have access to family doctors. That's essential to make sure that people get rapid care and that their conditions don't get worse and then they have to go to the emergency ward. This is a priority that all ministers of health share. But Minister, I'm sorry to interrupt you. I don't want to be impolite. I just have limited time. But my question is really this. We've had 3 commissions and 5 reforms in Quebec. Don't you feel that Quebec has done what it needs to optimize its use of the funding? The question is asked in the context of the situation we're familiar with. But if we go back to the situation 10 or 20, 30 years ago, it's hard to compare because we have an aging population, demographic changes, and so the situation is even more serious than it was 10 or 20 years ago. And so we have to make a greater effort than we have before. I understand that you are avoiding answering the question, and I understand that. Now, I have another question. You are the health minister. You have to make sure that you deal with the Treasury Board and so on. Now, I want to come to cannabis. We have certain cannabis products that are used for medical purposes, and we have the excise taxes that apply and other taxes. So I'd like to know whether within your department and you personally, you have thought about the tax treatment for cannabis products. There are 2 aspects to that question. Part of that comes under the jurisdiction of my colleague, the Minister of Finance, regarding taxation of all products, including cannabis products. Now, when it comes to the health minister, my job is to protect the health and safety of people. We've made substantial progress in Canada over the last number of years. Millions of people, including young people in particular, have been better protected because they can obtain cannabis legally and not just through illicit dealers. Thank you. Right now in Canada, we have wax pen, which is a sort of colored pen-like device that has no odor. It's practically undetectable. It has no smell, and the level of THC can be up to 99%, which is well over the 30% that is allowed for. Now, I would like to know what is happening within that because it goes against all of the regulations. You're quite right. We need to make sure that regulations are followed and that we have the best regulations necessary. I'm just going to ask my Deputy Minister to answer this question. Thank you. We have a group that is working on regulatory enforcement.
Identifying specific incidents or concerns. When that information comes to their attention, they follow up and work as appropriate in conjunction with law enforcement. So certainly this is an area that they will have been focused on, and any illegal products are subject of compliance and enforcement actions.
Et sur le produit du wax.
This wax pen, which seems to be becoming increasingly popular, is this something that you've been alerted to and you're working on?
Je n'avais
I don't have information to respond to that specific question, but I can say that any information that comes to our attention that indicates that regulations are not being followed will be acted on. We do proactive enforcement of regulations. Thank you.
Mr. Davies, please, for 6 minutes.
Thank you, Mr. Chair, and I'll be splitting my time with my colleague, Gord Johns, the NDP critic for mental health and addictions. Ministers, officials, thank you for being with us here today. Minister Duclos, I'd like to start with you, if I could. Provinces, of course, are claiming that the federal government is only paying about 22% of healthcare costs in Canada. Do you agree with that number? And if not, what number do you think is more accurate?
Well, here we have an example of a futile fight and a useful battle. The futile fight is on dollars, tax points, percentage points, because if we were to do that, we would need to recognize that since 1977, if you take into account both the cash transfer and the tax point transfer, 35% has been the norm and is still the norm now. The total support of the federal government in terms of healthcare is about 35%. Went up during COVID-19 and is back around 35% now. So that's a futile debate because it would suggest that the federal government doesn't need to do more. But we said we will be doing more. And that's why the useful debate, the useful battle is how we are going to unite together and fight for healthcare workers and patients across Canada.
So do you subscribe to the theory that the federal provincial cost share should be 50-50?
That 50-50 comes from a law or a rule dating from 1960 or some of that sort, which
some
where
of the,
the federal government
come from
would
the 1960s, Minister. Some of the best things come from the 1960s.
I know, and we are thinking of you in particular, obviously, Don. But beyond that, at that time, my understanding, and we can discuss that further if you want to, the understanding that the federal government was paying only for hospital costs, but not any other costs. Obviously, healthcare is more than going to a hospital. It's having access to a physician, having access to a nurse. So that's why the 50% is making nonsense now, because it would suppose that the federal government would pay only for hospital costs, and the federal government needs to assume responsibility beyond the cost of hospitals.
Well, thank you. So let me move to that. At the recent health ministers meeting in Vancouver, you announced that the federal government was prepared to put more money into the Canada Health Transfer, provided that the provinces agreed to 2 specified conditions. Did you communicate how much money that would be, and if so, how much?
So it's very good that you point to those 2 outcomes that we were hoping to share, because we had all agreed on them until just a few days prior to the conference. And these were plans to support health workers and to modernize our healthcare system. Supporting healthcare workers, because we all understand that it's the only way to support patients, and modernizing our healthcare system because the use of data in our healthcare system is antiquated. We don't have a world-class...
Minister, I don't mean to interrupt, but I agree with you on the conditions. My question's on the amount of money. You said you'd put more money. I'm asking if you actually specified the amount of money you'd put on the table.
So what we said, because the Prime Minister had asked me to say that, is that we were willing and hoping to do that, to increase both the CHT and bilateral funding to provinces and territories to support the priorities on which we had all agreed until then.
Did you attach a number?
Until then, meaning supporting healthcare workers with a pan-Canadian health workforce plan, which was exceptional, built by the efforts of provinces and territories, may I say, and data plan, just to make sure that people have access to their electronic medical records, for instance, and that the healthcare providers can use data safely to care for their patients.
Thanks, Minister. I'll turn it over to my colleague now.
Today marks 2 years since one of my staff members lost her brother Ryan to toxic drug poisoning after he was unable to access treatment. Every day, more families receive tragic, life-altering news because their loved ones don't have the supports they need. And at this committee on June 15th, I asked about investments and supports for people who use substances or are in recovery. And Minister Bennett, you spoke about the substance use and addictions program, saying, we know the SUAP program is hugely successful and oversubscribed. We will get that money out the door, and if we need more money, we'll go get it, end quote. This month, I received a response to a question on the order paper demonstrating how oversubscribed the program is. And after 2 calls for proposals, only 14% of the funding sought has been granted. The response mentioned funding availability as a reason for not selecting projects, as well as a list of 138 projects being kept in an inventory for future consideration. It's clear we need more money to provide the supports people need. When are you going to go get the money?
Thank you. And I think it is heartbreaking, and I think we are very grateful for your leadership on this, and the debate that you and MP Hanley had in earlier this year was hugely important in having all members of Parliament share that this isn't a they problem anymore, this is a we problem, and that we all know way too many people affected by this
And we all know
crisis.
we need more resources.
And I think that $116 million that were in last year's budget, another 100 in this year's budget. I mean, last week I was able to announce another 24 projects. We are signing these agreements as quickly as we can. You're at 14%. But I mean, in the spring with the Prime Minister, we were actually able to renew a number of these. We are working quickly on this and working with our partners to make sure that the innovation is taking place and that the kinds of substance use and addiction programs can be scaled and
Minister, you said
raised.
you'd go get the money. Are you going to go get the money?
We have the money getting out the door on the 116. We've got the other 100, and we will get whatever more money we need.
What about the
Mr.
86%?
Jones,
We are working
we're
on
past
it.
time. Next, Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair, and thanks to the ministers for being here, as well as all of the departmental support. This is a really quick question to Minister Duclos. On what date did you first raise the issue about children's pain medication shortages with your department?
The department, if you want more details, the department can provide them. The department follows such situations on a daily basis.
No, Minister, I asked, on what specific date did you first raise this with your department? I've asked your department, they refused to give me an answer. On what date?
Well, as I just said, the department collects those data on a daily basis and comes to my office whenever that is useful.
Well, that's disappointing to a lot of parents that have been struggling with this for a long time, and that is another non-answer. I'll switch gears here. The Canada Mental Health Transfer was an election promise, Minister Bennett, $4.5 billion. When are we going to see that? Like, we need this money desperately. We've heard tons of data. When are we going to see that money?
So thank you for the question, and I think that what we are hearing is having designated funds for mental health and substance use is really being important. It's been important from 2017 with the $5 billion that was there. The provinces and territories are now getting an ongoing $600 million a year to 2027. And now we're working with the provinces and territories on their 6 priorities so that we can develop the kind of programs on integrated youth services, on additional mental health and primary care, on the kinds of things that will involve bilateral agreements, but also the data returned so that we know that
I have
that
a
money's
very
getting.
limited amount of time. I'm asking very succinct questions, so I'm going to be asking and imposing that you answer very succinctly. How much of that money has been allocated to the provinces today?
So we now have the $5 billion allocated since 2017. It will continue till 2027. $600 million a year is going now annually, and we are working with the provinces and territories on the design of a program that will be
So how much has been
transparent.
allocated directly to the province of Alberta today?
the province of Alberta is getting its share of the $600 million this year.
Can you please table with the committee how much of this money has actually been allocated to every single province across the country and the territories?
Well, right now in Alberta, for this year of 21-22, Alberta is getting the $69.81 million.
I didn't ask how much they're getting. I asked how much has been allocated.
Of additional money because of the bilateral agreements.
It's just unfortunate. I think this is part of a trend we're seeing. We're seeing emergency rooms that are overcrowded from coast to coast to coast. We know that there are kids ending up in these emergency rooms because the parents can't find children's pain medications and the kids have fevers. We have people who are struggling with mental health and addiction issues and they have nowhere else to go. And they are filling up our emergency rooms at record rates, and we're seeing an absolute lack of action from this government to actually solve these problems. People are struggling and suffering today. What are you doing to actually make sure that people get the support they need so they don't fill up our emergency room?
It's a great question because that's exactly what we're doing. By building up the integrated youth services, those kids don't go to Emerge anymore. When we look at DCRIM, when we look at the SUOP programs, we're going to watch the paramedic response, the visits to Emerge, the hospitalizations. We are already seeing those changes. And so it's building up a system so that people don't have to go to Emerge is exactly what we're doing coast to coast to coast.
Minister Duclos?
You heard Dr. Bennett. She not only is she the first mental health and addictions minister, but she's also, as you will know, a very distinguished physician. And when she speaks about how to make people not having to go to an emergency department because of a failure from the system to access a family physician or mental health in the right place at the right time, these are significant efforts that we need to continue making together.
That's 5 minutes, Ms. Goodrich.
But my time is up, but we are actually seeing a crisis right now in our emergency rooms. The time to act was 6 months ago or 6 years ago. It's critical that we get this done now.
Thank you, Ms. Goodrich. Dr. Hanley, please, for 5 minutes.
Merci, Monsieur Président.
Thank you, Mr. Chair. I also want to thank the ministers for coming here this morning and for all the officials as well for being here. It is a long time since we've seen some of you in person.
Several questions for you. I think one, I'd like to start with, I think there's been some recent confusion regarding politicization of the approaches to addressing the toxic drug crisis, which we know requires an array of responses along a spectrum from prevention, health promotion, harm reduction, access to clinical treatment services, including opioid agonist therapy, other clinical supports, adequate social supports, access to treatment and recovery for those who are ready. And may I mention legislative actions such as we've accomplished with Bill C-5, which addresses unfair mandatory minimum policies, and modernizing drug policy, including ultimately decriminalization of personal possession of illicit drugs. And of course, as an MP, I represent the Yukon, which is still struggling in the opioid drug crisis, but nevertheless has made some substantial gains in a number of these areas. So my first, maybe very quick question, how much should we rely on values alone versus evidence in determining drug policy or any health policy for that matter?
Well, I think you know the answer, Dr. Hanley. This has to be evidence-based. I think we've suffered through 10 years of an ideological approach which took one of the pillars, of the 4 pillars that you've just mentioned, of international drug policy, of prevention, harm reduction, treatment, and enforcement, and took out that harm reduction pillar, and now we have to build it back up in terms of the way that you have just said, getting naloxone out onto the streets, being able to understand that harm reduction includes these things that have been 40 years old: methadone, Suboxone, Sublocade, but also all other safe supply. And as you know, we've reversed 42,000 overdoses in the safe consumption sites.
Thank you. And on that note, how robust is the evidence to support harm reduction in general and safe supply in particular as one of the spectra of approaches to tackling the drug crisis?
Yes, well, I think that the CRISM part of the CIHR is monitoring all of this very closely, certainly even in the integrated youth services, that research and evidence is very much part not only of using the evidence but creating the evidence as we go. And it is about us understanding that we have to be going on, and in the agreement with British Columbia, we will be measuring the indicators not only on public health, saving lives, access to emerge, all of those things, but also public safety as we watch petty crime go down, as we watch the other indicators of public safety. So evidence is everything in how we take decisions in drug policy.
Thank you. Now, Minister, I have the privilege of co-chairing with Senator Stan Kutcher the All-Party Mental Health Caucus. And we met just yesterday, actually, and were presented with data documenting the mental health effects of the pandemic on Canadians. But also one of the themes we've discussed is how we can build mental health literacy. And that's, to me, familiarity with the terms and principles of mental health and mental illness. So we can all be better equipped to maintain good mental health, but also to prevent and recognize and respond to mental illness when it occurs. And that's whether we are members of the public and citizens, whether we are parliamentarians or healthcare providers or patients. So I'm wondering if you could speak to the importance of supporting better mental health literacy and what role can we all play in improving that?
Well, firstly, I want to thank you, but also the All-Party Mental Health Caucus that worked so hard on that handbook for mental health literacy for all parliamentarians and our teams. This has been hugely important that people are using the right words and being able to understand their feelings and describe their feelings, but also know how to navigate themselves or their loved ones to help. I think that when we look at stigma, that I think the best way to replace stigma is with education, and that when we raise the mental health literacy of our population, that we can actually understand that we've been asking the wrong questions. It's not what's the matter with that person, it's what happened to that person in terms of trauma informed. Is what we're giving culturally safe, or is it a high barrier because people have been treated badly before and are afraid to really reach out for help? So I think if we could do more on mental health literacy, really in the curricula of all the schools across this country, I think that has been the goal of Dr. Kutcher, that when we have health classes, there should be mental health classes too, so that people are actually able to be in touch with their feelings, that stress is, for an exam, isn't an anxiety state, that grief after someone's died is not a depression, that these are what are our normal emotions, and when do those normal emotions tip over into the kind of illness that requires treatment.
Thank you very much.
Thank you, Dr. Bennett. Monsieur Garon, pour 2 minutes et demie.
2.5 minutes, Mr. Garon. Thank you. Mr. Duclos, in a number of municipalities in Quebec, and I imagine across Canada, there seem to be major problems with the access to cannabis for medical purposes. I hear about this frequently from individuals and municipalities. We imagine, or we can take for granted, that there are criminal organizations involved in some of the cannabis retailing. And so we wonder if this is a priority for you and to what extent, and what measures you may have taken already. As you know, cannabis is legal, regulated, and available. How it Why is it that permits are still necessary? It seems like they should be less necessary now. Thank you. That is an excellent question, and I want to use that question to highlight the importance that medical cannabis has taken on over the past few years. We have had the right to buy cannabis established. It is a right that has been confirmed and continues. Things have changed a great deal in the area of cannabis production. We need to ensure the security and safety of people, and we have certainly made improvements in that area. We can always do better. We have a major opportunity with the review of the legislation. I just have a few seconds left, but what level of priority does this have for you when you meet, and what have you done as a minister to deal with this situation? This is a very high priority. What I will do, if it hasn't already been done, is to send you information that will show how seriously the department takes this issue. And this, we understand the importance for your writing. I will be very, very eager to receive that information. I think it has been sent a few months ago, but I know you receive a great deal of information, and there may be updates. Thank you.
In another order question, I asked whether the government agrees with the recommendations of its expert task force on substance use. And in response, it was indicated the government agrees with the spirit of the recommendations. And one of those recommendations was, quote, an expert committee should be convened within 3 months of this report to lead the design of a national safer supply program with the goal to increase access to safer supply for up to 1 million Canadians at risk of death from drug toxicity, end quote. Last week, in response to the Conservative leader's misinformed comments about safer supply, you said, quote, the evidence is clear on this. Safe supply saves lives. Now, it's been nearly a year and a half since the task force made that recommendation. What steps are you taking to establish a national safer supply program, and have you established a committee to lead the design?
Thanks for the question. And yes, indeed, the community of safer supply, the national community of safer supply, has been struck and is advising the government. Shannon Nix in her part of Health Canada, and I don't know whether Heather wants. I'd be happy to let you know the members of that committee and really the work that is being done. I think that the community of the safer supply is working hard on those that are prescribing, but I think, Gord, you and I know that the coroner's report in BC is extremely troubling, that only 30% of the people who died of opioid overdose were actually diagnosed with opioid use disorder. So I think we know we've got to go further than just a prescriber model.
Thanks. Last question to the Minister of Health. Minister, Canada's rising food prices are hurting families that were already struggling. Nearly a quarter of Canadians report going hungry due to cost, and 2 million children are now at risk of going to school hungry across the country. In the last election, both Liberal Party and the NDP pledged to invest $1 billion to establish a national school nutritious meal program to ensure that no child is forced to struggle through the day on an empty stomach. We know nutrition is a key part of health. Can you confirm when that funding will be in place and when Canadians can expect a national school nutritious meal program?
Thank you, and it's totally appropriate and appreciated that you point to healthy eating as an important social and physical determinant of healthy living and a healthy being, and that's why, as you've signaled, we did commit to doing more when it comes to providing healthy meals and healthy snacks to children, in particular those whose families can't afford to do that with the current circumstances and the pressure on the cost of living. So this is a commitment that involves several ministers, and an important one is the Minister of Agriculture. But my other minister, Minister Gould, Minister of Families, Children and Social Development, is also part of the efforts, and we look forward to working with you in making sure that we can make progress on that important support that children and families in Canada need to remain healthy.
Thank you very much, Mr. Johns and Mr. Minister. Ministers, I'd like to finish this second round, which means we have two more 5-minute rounds, one from the Conservatives and one from the Liberals. I hope you'll bear with us. Mr. Cram, please, for 5 minutes.
Much, Mr. Chair, and thank you to all the witnesses for being here today. Minister Bennett, I believe the last time we talked was earlier this month at the breakfast event put on by the Canadian Institute for Public Safety Research and Treatment, or CIPSRT for short, which is based at the University of Regina. And as I'm sure you're aware, CIPSRT was established about 5 years ago with a $5 million funding grant, which runs out at the end of the fiscal year. And so I would like to know, does the government have any plans to fund CIPSRT moving forward?
Thank you.
Through you, Mr. Chair.
Thank you so much for the question. I think that CIPSRT is one of the examples of creating the kind of evidence necessary to be able to have law enforcement with the tools they need to stay safe themselves, but also be able to access care when they need it. I think that what we've seen with CIPSRT, particularly at Depot, where those young recruits are regularly checking in on their mental health, that this is a model that really works, and we are working with my colleague, Minister Mendicino, in terms of, again, the support for CIPSRT ongoing.
Okay, well, it's good that you're working on it, but is there going to be any plan for actual funding? And the reason why I'm asking is because they are starting to run out of time. They are bound by the ethical code of conduct for mental health research, and the ethical code of conduct says that if they're going to allow new subjects to enter the program, they have to have enough time for them to complete the program, and that means that they will not be able to accept new subjects past Christmas. And if you look at the calendar, Christmas is coming up soon. So I'm wondering for the people at the University of Regina who may be tuning in today, what should they be doing? Should they be winding down operations because there will be no funding moving forward, or should they be ramping up operations? When are they going to know about their futures?
Thank you again for the question, and I promise you that I will continue to work with public safety and be able to express my support for the program, and that it really is making a huge difference. And I think with so many programs like this, that, as you know, a number of law enforcement agencies around the country are using this model, and we do think that the model could be an example of something where we could have a national standard, that all law enforcement would have that kind of mental health support and protection.
Okay, so I'm not getting a very concise answer, Minister Bennett. If you can't provide a concise answer as to whether or not CIPSRT will be funded moving forward, can you provide an answer as to why you cannot provide an answer? I mean, this is a 5-year program that is coming to an end in a few more months. Why has this not been on the government's radar?
I assure you, it is on our radar and my radar, and we, as you know, Minister Mendicino was at the breakfast with those very laudatory comments and the evidence that they are producing on a regular basis. And I promise you that Minister Mendicino and I will be there wanting to do whatever we can to support the project.
Okay, thank you, Mr. Bennett, and I will be handing over the rest of my time to Dr. Ellis.
Thank you very much, and through you, Chair. Minister Duclos, the CMA president described our health system as on the brink of collapse. This, to me, would be an all-hands-on-deck type of strategy that would be needed to solve this problem. And I guess the question is what are you doing about it?
And Dr. Lafontaine, Alika, is right. No, the system was harshly impacted by COVID-19. Even now, as we speak, about 10% of hospital beds are occupied in Canada by people with COVID-19, and there is a flu. There are respiratory viruses impacting children everywhere, and our healthcare workers are tired. Many of them are sick. Many of them have left, and unfortunately, many others are thinking of leaving. In addition to that, there are severe demographic pressures in Canada, which will last for many years to come. So that's why we need to work together and to invest the sufficient resources needed to go forward.
Thank you very much, Minister, and again for you, Chair. I guess what Canadians are expecting is some action. The meeting with the provincial ministers really ended in failure. Somebody walked away from the table. It depends on which press you read, who it was, you or them. The finger pointing needs to be done. Canadians want action. The system is failing them. Your government, sir, is failing them. And Canadians see no action whatsoever. What are you doing specifically?
You point to, Chair, can I go? You pointed to
we're out of time, so be concise, please.
That's very unfortunate.
You've got one more round of questions. I know it's a massive question. I'm sorry that he put it in right at the very end.
That was a great question.
Go ahead.
The question was great. The answer could have been great if I had had more time. But I'll say that the good news is that the meeting was important. We were all aligned with the same priorities, the same diagnostics. The unfortunate thing is that we were not allowed to speak openly and publicly about the results we wanted to achieve together.
Very much. Okay, the last round of questions is going to come from Dr. Pawlowski for 5 minutes.
Well, I'm going to give you the opportunity to give that great response, so I hope it's good.
Thank you, Marcus. Well, you would have loved to be there too, Marcus. You would have loved to be there because between health ministers, we spoke of things that matter to Canadians. Access to a family doctor. You're a family doctor. You know what it means. Access to mental health services in the appropriate manner at the right time. This is mostly important to Canadians. Reducing backlogs in surgeries and treatments. 1 million surgeries have been delayed because of COVID-19. Our health workers are struggling to catch up with those backlogs, but the current circumstances make it very difficult for them to do so with all of those viruses that go around. And by the way, one way to protect the health workers is to be vaccinated. And I know everyone around this room believes in vaccination. And to be vaccinated against the flu, against COVID-19, it's not perfect, but it works. And it saves lives, and it protects the health of patients and also the mental and physical health of our workers. The good news, therefore, and you would have been so happy to see that, Marcus, is that everyone was on the same page. Unfortunately, the premiers asked my colleagues, health ministers, to stop speaking about results and outcomes that matter to Canadians and only to talk about dollars. But dollars, although they are necessary, are not enough to generate the outcomes that Canadians need to see. So sending dollars to finance ministers is not my job, and not Carolyn's job either, and it's not our job here at the federal government. We are there to support Canadians, and we want to support, in the process, our colleagues, health ministers. So you would have been very happy to see this, except for the fact that we were not able to speak openly about the great conversation we had in private.
So am I right that there was the offer for federal financing to address the healthcare workforce shortage as well as to address long waiting times for surgeries?
And the answers are twofold. First, we have been providing enormous level of support throughout COVID-19. Now the $72 billion just for health and safety, the 8 out of $10 that the federal government paid for to support the efforts of provinces and territories, the recent increase in the CHT, the 10% increase in the CHT in March 2023, the $9 billion, $3 billion for health, mental health, $3 billion for home and community care, and $3 billion for long-term care. That's all there, in addition to the $2 billion for the reduced backlogs in surgeries and treatments that we announced just a few weeks ago, which are making a big impact now in the ability of provinces and territories to look after workers and patients. So we've done a lot, but the Prime Minister said that we need to do more, and that's why we made that announcement prior to the conference in Vancouver. You would have been proud of that too, Marcus.
Question for Dr. Bennett, and the amount of money going for mental health and substance abuse. I know we make our decisions, they're evidence-based, so supposedly we're doing the right things. We believe in harm reduction. It should be working. However, having recently gone to Vancouver, where Don Davies and Gord Johns are from, it's hard to see things have gotten better. Hastings Street is awful. It looks like a slum from a third world country, and I've lived in a lot of third world countries. If you look at Thunder Bay has apparently a higher per capita overdose rate than Vancouver does. What can you say in order to encourage us that things, in fact, are getting better, that our money is, in fact, getting well spent?
I think focusing on the downtown east side has been a real problem, and I think we've been very upset with the video coming from the Leader of the Opposition. I mean, even Ben Parent, the previous public safety advisor to Stephen Harper, said no public figure should use real human misery as a backdrop for political pitch. It is using them as props to peddle his snake oil was disgraceful. For us to use that stereotype when so many of the people dying are construction workers, people in the natural resources, they're people who've had psychic pain or physical pain, were cut off their medication and are going to the street for their drugs and are using alone and dying alone. So it's really important that we help them. Those are the Mom Stop the Harm sons. Those are the people that we are losing. When we watched that mom in Sudbury put in number 245 and number 246 of the little crosses of all the sons and daughters that have died in the overdose crisis there in Sudbury. This is across this country, and it is extraordinarily important that the harm reduction of methadone and Suboxone and Sublocade and Dilaudid and all of those things is really important. But it is about changing our mind as we said last week in National Addictions Awareness Week, this is about creating a community of compassion. And you cannot underestimate what the 42,000 overdoses that were reversed in a safe consumption site, those 42,000 people would have been dead. And so this is terrible. It's about the toxic drug supply, but it's understanding addiction, which is physical. And that when people are seeking medicine to not be dope sick, it is very, very misguided to think that a one-size-fits-all approach is going to work, and we're doing everything we can to stop this national tragedy.
Thank you, Dr. Bennett. Thank you, Dr. Pawlowski. And to both ministers, that concludes 2 full rounds. We kept you longer than we were supposed to, so we are grateful for your patience and staying on. We're grateful for you making yourselves available and being so patient with us. So thank you so much, colleagues. We're going to suspend for about 3 or 4 minutes just to let the ministers carry on, and then we'll continue on with officials. The meeting is suspended. come back and take up their places. Colleagues, can we come back to our places so that we can resume? I call the meeting back to order. The officials are with us and were introduced at the outset of the meeting, so we're just going to continue on with questions until about 12:45, at which time we'll have to stop in order to formally adopt or not adopt the supplementary estimates. So there's a series of votes that we need to undertake. So we're going to we'll stop at about 1:45 to do that. So next up is Dr. Ellis for 5 minutes.
Well, thank you, Chair, and thank you to the officials for continuing to be here today. Certainly important questions that we want to continue to try to have answers to. I mentioned previously when the ministers were here that the CMA president talked about that we're on a system on the brink of collapse. I certainly would be more forceful with my words. I think we're in a system that's collapsing around us. Sadly, as we've heard from the minister, there hasn't been an answer with respect to the promise of the Prime Minister of this country with 7,500 doctors, nurses, and nurse practitioners. We may go ahead and say that, well, this isn't the purview of the federal government, but guess what? It was the Prime Minister who said that. Unfortunately, there doesn't appear to be any answers with respect to how many of those folks are actually on the ground. And I guess, Dr. Lucas, if I might ask you that particular question, how many exactly of the 7,500 doctors, nurses, and nurse practitioners have been hired?
Mr. Chair, I'll start recognizing the incredible contribution health workers have made through the pandemic and continue to make, and the challenges that they're facing, as Dr. Ellis noted, and Dr. Lafontaine has spoken about in his role as CMA president. As Minister Duclos noted, the government committed as part of its focus on priorities to work with provinces and territories in the health system, $2 billion to support clearing backlogs, and through that, recognizing that a critical element of that is the support for hiring health workers. Officials have been working under the direction of federal, provincial, and territorial health ministers to support methods to retain, recruit, support better data and planning, and innovate in care models to support health workers, including increasing recruitment and supporting internationally educated health workers, and this work continues.
Well, thank you. Through you, Chair, if I may, Dr. Lucas, if I could ask your department to specifically table with this committee how many of these 7,500 doctors, nurses, and nurse practitioners have been hired to date with the $3.2 billion that has been pledged.
Mr. Chair, we're happy to follow up with a report on information about health workers in the country. This is an area where we're working closely with provinces and territories and the Canadian Institute for Health Information and other health stakeholders.
Well, thank you very much. And through you, Chair, if I might, can you actually, Dr. Lucas, in follow-up with respect to that, tell me how many international medical graduates have been hired in this country in the last year?
Mr. Chair, I don't have that information offhand. Provinces and territories have that information through their own processes, and we can work to provide a report based on information from the Canadian Institute of Health Information and other stakeholders on internationally educated medical graduates and other health professionals.
Thank you very much. Through you, Chair, if I might, would you agree, Dr. Lucas, that international medical graduates are going to form a significant part of our response to the terrible crisis that's ongoing and recruiting more healthcare providers in this country quickly?
Mr. Chair, what I would indicate is that I think there's a broad recognition of support needed across all health professions, both through existing health professionals trained at institutions across Canada, recognizing provinces and territories working those institutions are seeking to increase enrollment and recruitment, and that as in past years and decades and looking ahead, internationally educated health professionals, including many who are here in Canada, need support to go through the credential recognition process and can contribute in health professions, as indeed is the case now and will contribute in the future to the health workforce in Canada.
Well, thank you very much. And through you, Chair, I think I have time perhaps for a little bit more. Your government committed specifically to an autism strategy from a federal lens. Could you please comment on the autism strategy?
Sorry, that would be, Mr. Chair, about the autism strategy. What we have been working on is developing an autism strategy based on the engagement and information which we have had collected through our constant work with provincial, territorial, Indigenous, and with other stakeholders. And we have also focused on putting together a specific workshop or a specific a meeting which happened in the middle of November, just to make sure that we collected all the information so that we could get that robust strategy in place. And this is going to be something which we will be able to finalize by spring of 2023.
Thank you, Dr. Kochar and Dr. Ellis. Next, Mr. Joe Harry, please, for 5 minutes.
Thank you, Mr. Chair, and welcome to the officials. I'm going to start with Dr. Lucas. Very high level, this supplementary is asking for about $25 billion in voted. It's broken down among four areas: Indigenous reconciliation, immigration strategy, COVID-19 funding, as well as the cost of public servants' salaries. I want to focus on COVID-19. My understanding is the supplementary estimate B is asking about $4.8 billion in funding for COVID-19 related measures. Can you tell me to date how much, with this additional $4.8 billion, what would be the total spend or what we are planning to spend on COVID-19?
Mr. Chair, I'll speak in part to that from a Health Canada perspective and turn to Dr. Kochar to speak from a public health agency perspective. Certainly the supplementary estimates do include important investments to support our work on COVID-19. On the side of Health Canada in particular, it includes statutory funding of nearly $1.8 billion to support the acquisition of rapid tests. To date, we have acquired over 800 million rapid tests to support Canadians across the country in all regions, of which 560 million have been acquired this year and provided the provinces, territories, not-for-profit organizations, and others to support communities across the country. We've also have support in the estimates to support our work on the regulatory system to ensure expeditious review and ensuring the safety, efficacy, and quality of vaccines and treatments for Canadians. I'll turn to Dr. Kochar to speak specifically to the public health side.
Thank And Mr. Chairman, what we are looking for is basically a $1.42 billion e-profile, and this is mostly focused on the COVID components, which is medical research and vaccine development, which is, again, one of those core pieces where we are continuing to receive more bivalent vaccines. There is also logistics for vaccine distribution as we move the vaccines when we receive from the manufacturers to the PTs, and also there is a component of national emergency strategic stockpile in there. And finally, there is some amount of testing which is related to both wastewater surveillance and other testing, which our National Microbiology Laboratory continues to do as such.
Thank you, Dr. Couture. You were talking about the research and vaccine development. And I also noticed that we're earmarking $732 million to support public health measures in developing countries. Does any of the officials have any idea as far as what the scope is? And
the information on that component is mostly related to supporting both in terms of our efforts to really provide those ancillary aspects for vaccination, where we donate the vaccines. We also provide them with ability to have other aspects, for example, syringes, needles, and other components. But also there is a piece which continues to be focused on how can we assist them with their own capacity building so that we can reduce any variants of concerns or variants of interest originating from that component. So that's a investment to really focus on that.
Thank you. There's also about $400 million for border and travel measures and isolation sites. Is there any of the officials can make any comment around more specific around the travel measure, border and travel measures? I'm interested to know where is this $400 million being spent on?
Thank you for the question again. And this is a $400 million which was asked for the border measures, which have been taken away as of October 1st. But we are finalizing most of the contracts which were in place for mandatory random testing, compliance and verification, and so on. So we're tying it up. However, this $400 million will not be used as completely, and we will, again, want to make sure that we have tied up rest of the contracts, and then rest of the money will not be utilized as such. But that was a supplementary ask earlier during the time, going up to December of 2022.
Thank you, Mr. Johari. Monsieur Garon, pour 2 minutes et demie.
Mr. Caron, 2.5 minutes. Thank you, Mr. Chair. My question would be for Dr. Lucas, the Deputy Minister. Quebec recently published its 2022 policy on rare diseases to provide information, support research, and so on. There were 3 aspects. I know that the minister's mandate letter included this. We saw that we have demands for drugs for these. I would like your reaction. Mr. Chairman, Health Canada is working closely with the provinces and territories and other stakeholders as well, including advocacy groups and industry, to develop strategies specifically to have funding to deal with the cost of these medications. My question is really just to be more specific. When you say you work with these people, are you just having conversations or are things actually moving forward? The plan is advancing. We are making progress.
We've worked on a draft strategy, engaged provinces, stakeholders, and other colleagues through the course of last spring. and are working to finalize the rare disease strategy, and specifically drugs for rare diseases in the coming weeks, such that Canadians can receive the support from this. The government provisioned funding in budget 2019 to support this.
Merci.
Thank you. On another topic, Quebec and Quebec doctors have asked for a national registry to on medical devices, on devices that could pose a health hazard. I would like to know whether this is something being taken seriously. We want to protect women's health, and we want to know what has been done. I will ask Supriya Sharma to answer this question.
Sorry, I shouldn't have touched it. So certainly the issue of a registry for breast implants or other joints and other medical devices has been raised in the past as well. We're actually in the process of working with CIHR to put together what's called a Best Brains Exchange, which brings together experts in different federal departments to ask the question. So, if we need a breast implant registry, what would that look like? Who should host it? What would that entail? So that's something that's actually being actively planned right now, and will be happening in January 2023. And then we're working with partners to advance that.
Merci.
Thank you. I want to come back. I'm afraid your time is up, Mr. Garon. How much time did I have? 2.5 minutes. Thank you. Thank you.
Davies, please, for 2.5 minutes.
Thank you. Got a few questions here. I'm curious to follow up on the investment the federal government made to construct the new biologics manufacturing center in Montreal to produce vaccines. We were expected to produce up to 2 million vaccine doses within a certain amount of time. Can you confirm if we are producing any doses of the COVID-19 vaccine at the NRC's biologics manufacturing center?
Mr. Chair, I will respond in part, and certainly would recommend any follow-up with the National Research Council itself. But indeed, the investment made has resulted in the construction of a biologics manufacturing center. It is going through the final stages of its good manufacturing practice compliance and assessment of batches of vaccine produced there. It is being done through a partnership with Novavax in terms of production of that vaccine.
Is there any idea when we might see actual doses produced?
They're being produced now in terms of ensuring that the full regulatory compliance and the test results on the quality of the batches can be ascertained to complete the certification of the facility.
Just a minute there, Dr. Lucas.
There seems to be a problem with the interpretation. Oh, there it is. Okay, very good. So if you can just speak English, is this yes, it's working now.
I don't know if you had finished your answer, but...
Just the process to complete the certification of the facility and the specific vaccine batches being produced is working towards completion. And for information on further steps towards production, the National Research Council would be best.
Okay, we'll ask them then. Just recently in the news, there's been some confirmation that alcohol is a carcinogen, and it's is linked to at least 7 types of cancer. I'm just wondering in the department if there's any concern about this and any moves to make alcohol containers carry warning labels in Canada like tobacco products do.
I'll turn to Heather Jeffrey to respond.
Yeah, so we've been working with the Canadian Centre for Substance Use on the low-risk drinking guidelines, which were put out for consultation. In addition, we've been supporting research and community approaches. We know that certain populations are most frequently experiencing harms from alcohol, include women, include Indigenous peoples, include as well youth. So we're focusing on awareness and advertising, both from Health Canada but also with our provincial partners. We're continuing to fund the low-risk drinking guidelines for awareness of risk. CIHR as well.
So with respect, it was about labeling on products.
So Part of our consultations have included funding a study with the Yukon on labeling of alcohol to see the evidence on what labeling can assist with, and as well funding through SUAP managed alcohol programs and clinical management. So this is part of the consultations and what we're working on for.
Ms. Jeffrey, thank you. Mr. Davies. Next, Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair, and I'm just going to get right into it. We've been bringing up the issue around children's Tylenol for quite some time in this committee. As you guys are well aware, yesterday you guys released that in the last 2-week period, 1.1 million units of children's pain medication have come into the country, and they're now being distributed at hospitals and in pharmacies across the country. My question is, can we expect to see 1.1 million units arriving every 2 weeks?
I'll start responding, and then I'll turn to Dr. Sharma to contribute. As we discussed last with the committee, and Minister Duclos noted, efforts have been made to work with manufacturers to increase domestic production, and indeed it's up 100%, as noted in the information pertaining to the 1.1 million units in November of Advil. The additional 1.1 million noted in a report to the committee today pertains to the special importation of foreign labeled medicine, including Tylenol. And we are continuing to engage with manufacturers to increase that domestic production on an ongoing basis.
We have a very limited amount of time. Is the answer yes, we expect to be bringing this in at about that rate every 2 weeks, or no, we don't think we'll need it? What's the answer?
I mean, the short answer is yes. We'll continue to be working with all the manufacturers, the larger ones and the smaller ones, to increase supply. There's a number of proposals already on the table that are in the magnitude of millions of units coming in. It's difficult to know exactly when those might come in, but we know that there's still a demand out there. We still know that demand is outstripping supply. So we're working to get millions of doses in addition to the ones that are already in the country.
Okay, so my next question, super simple. I'm a parent, not a doctor. What the heck is a unit? Because I agreed to it thinking that this was better than nothing, but this makes no sense. Is this a case? Is it a bottle? What size is the bottle? This makes zero sense.
The bottles come in different sizes, so it can be anything from, for example, when we're looking at this acetaminophen that's at retail, the bottles are actually slightly larger size than the bottles that we would normally have, so 120 mils versus 100 mils. The hospital bottles are a little bit bigger than that. So the units do vary, but they're basically bottles.
Okay. So then to shift gears and go back to questions around the Canada Mental Health transfer. Are there plans in place to get the $4.5 billion that's been promised by the Liberals to be allocated, or is this still just a pipe dream?
So as Minister Bennett outlined, the $5 billion over 10 years is still only halfway through to completion. So that money is continuing to flow right now in real time to provinces and territories. In last year's budget, the government undertook to continue its work consulting with provinces, territories, and community organizations to build the underpinnings for additional investments in mental health. We've been engaging in consultations across provinces and territories, and also in thematic roundtables on a variety of areas, including perinatal mental health, integrated youth services, and other areas of required investment in mental health and substance use.
All right. So my question becomes, to kind of shift gears yet again, do you believe that addiction is a health condition?
Government and also Minister Bennett that we view addiction as a public health issue.
But do you see it as an illness?
I'll defer to Dr. Sharma to talk about the medical diagnosis.
Yeah, so basically there's a criteria, it's called the DSM criteria for mental health conditions that are considered conditions, and there are conditions in that diagnostic in that area that refer to dependence. So it's usually called substance use disorder, or there's different variations. So yes, it's considered an illness.
And what is the treatment for substance use disorder?
The treatment really varies by person, and I think, it's very similar to other issues that are related to mental health, that it's not one size fits all. So depending on the individual, depending on their circumstances, depending on their illness, they may respond to one type of treatment differently than another type of treatment. In general, it's making sure that they are getting care, that they're getting wraparound health care in terms of being able to deal with other illnesses that they may have, and then basically working with them to figure out which ones are the best options.
Really quickly, do you believe that recovery is possible?
I think, as Minister Bennett said, words matter. So recovery, it's really about getting people to a place where they are in their best health possible. That's a journey. We're trying to limit harms from substance use. The underlying illnesses that cause substance use disorder are really complicated, but I think that's the goal. The goal is to have people in good physical and mental health.
Okay. Thank you, Dr. Sharma. Thank you, Ms. Goodrich. The last round of questions for this panel will be posed by Mr. Van Couverden for the next 5 minutes, please.
Thank you very much, Mr. Chair. I appreciate the time that you've provided us with today and all of the answers that we've received to these questions. Thank you very much for being here, and thank you for what you've done to be able to produce this estimates, these supplementary estimates. My questions today are going to focus on kids. But first, I'd like to ask from those, really, my questions aren't specifically directed to any official. I think Canadians are sometimes concerned, and very rightly so, perhaps, with the way that the Canada Health Transfer is set up and the federal government's ability to target certain priorities. Specifically, I've been focused on children, on children's health care, particularly preventative health care, and trying to find ways as a federal government to have a positive impact on the health of kids in Canada. We've seen through various reports that the health of kids in many respects are heading in a negative trajectory rather than a positive one, and we would like to think that in Canada, being a wealthy country with lots of resources, we should be able to do better. It's challenging, though, because many of those priorities are difficult to find in a document like supplementary estimates because our funding goes to provinces in such a general manner. Can you speak a little bit, anybody who would like to, on the relationship that the federal government has with provinces and territories, and how we could start setting some priorities so that we can tackle some of the biggest national issues that our country faces with respect to kids?
Thank you, Mr. Chair. I'll start and then turn to Heather Jeffrey to speak further, but certainly support for children's health is a key priority for Health Canada and the Public Health Agency, and work at Canadian Institutes of Health Research, including work they've recently moved ahead on in terms of supporting research into pediatric cancer. We use federal responsibilities as well as convening to support on areas including healthy eating through tailored use of the Canada Food Guide, healthy living and active living as another key area to support communities and children's programs across the country, working with community groups, focus on pediatric medicine, as we've been discussing, and certainly recognizing from a regulatory perspective we need more targeted efforts on attracting pediatric medicines and formulations in Canada. But importantly to your question, one of the areas we're working closely with the provinces through targeted bilateral funding under the 2018 agreements on mental health and substance use is in integrated youth services, where, as Minister Bennett noted, we've made significant progress across the country. And I'll turn to Heather Jeffrey to give you a bit more information on that.
So integrated youth services, as Minister Bennett outlined, was an important priority area of the $5 billion in investments in mental health bilateral agreements that were made that is ongoing. She spoke as well to the fact that integrated youth services, which is really receiving youth with peer counselors who understand their living experience, wrapping them with the full suite of support services they need, medical, social, housing, and ensuring that they have all the supports they need to get through their challenges. We now have 50 operational sites as a result of those investments in our partnership with provinces, and there are additional 60 under development. We also know that youth need to be reached in different ways. Text and virtual online services through Wellness Together Canada have been very successful in reaching, in particular, to LGBTQ plus youth and others that want to speak with others with the same experiences that they are going through. So an additional $15 million investment to Kids Help Phone is part of that, to make sure that youth that are in crisis have someone to reach out to 24/7.
Thank you very much. Just moving on to vaccination from the perspective of some of the most avoidable diseases like measles and mumps and rubella, as well as the flu. We've seen that some jurisdictions across the country have been a little bit more hesitant in their messaging in terms of encouraging their populations, and I'm speaking particularly of very young children and the elderly. But parents in my riding have been writing to me concerned that their children are more susceptible to some of these very, very avoidable diseases because of lower vaccination rates. How can the federal government encourage provinces and territories to be more proactive in encouraging their communities to get vaccinated for some of these, diseases we didn't need to worry about a couple of years ago as much?
Thank you very much for the question. I will go at it in sort of two ways. Certainly in terms of routine vaccine-preventable diseases, I think certainly COVID-19 has had an impact. Provinces and territories, we've had very good discussion with the chief MOHs, and they do acknowledge there has been some slippage, obviously, because of public health measures over the past 2 years. Some children haven't been able to go to clinics, get their routine vaccinations against measles and so on. However, we've been fortunate so far with historically high vaccine coverage for what we call the routine childhood vaccine preventable diseases. We haven't had, I think, many cases of measles reported, and even in the last year or so, I think since March of 2021 till I think November 1st of this year, we've actually had 3 reported cases of measles to date, and they're all imported and associated with travel. So that doesn't mean we can rest on our laurels, and I think our provinces are continuing to do the catch up in terms of routine measles and other childhood vaccine preventable diseases. With respect to what's happening right now, and I think we all see it in the media with the triple menace in terms of, COVID-19 still around. There's also influenza, and especially for the young children, RSV. And I think it speaks to the fact that for the past couple of years, there has been, I guess, maybe the exposure to the viruses that might have been, happening in previous years. And so I think the message is that the federal government, certainly with the provinces and territories, for which there are vaccines available. And at this point, it is COVID-19, and now there are vaccines available from 6 months and older, as well as obviously influenza. You can also give that to children 6 months and over. I would say that, hey, we want to continue pushing, supporting PTs, be it with various campaigns, but also supporting what's happening at local level to say that everyone could or should avail themselves, because if we can prevent ongoing transmission of both, let's say, influenza, COVID-19, as well as, of course, besides vaccine, using good public health measures at a personal level, the continuing use of masks, et cetera, certainly in indoor spaces, and good hand hygiene. All that's going to contribute to mitigating against transmission and protecting our children.
Thank you, Dr. New. Thank you, Mr. Van Couverden. To all of our officials, thank you so much for being with us. Thank you for all that you do to support Canadians and to provide us with good and thorough and patiently and professionally presented information. So we're going to move now right to the votes. You are all welcome to stay, but you're free to leave. Thank you. Colleagues, there are in all 8 votes in the supplementary estimates B 2022-2023. If I have unanimous consent, we can group the 8 votes together. Absent unanimous consent, we'll deal with each one individually. Do we have unanimous consent to group all 8 votes together? Yes. No. Okay. So I will now put the question on each vote separately. Shall vote 1B under the Canadian Food Inspection Agency carry? Do we require a standing vote? So on division.
Let's do a standing vote. We've never done one of those before.
Okay. Mr. Clerk, a standing vote with respect to vote 1B under the Canadian Food Inspection Agency.
Mr. Henley. Mr. Johari.
Support.
Mr. Palowski.
In favor.
Ms. Sidhu.
In favor?
Mr. Vancouverden.
In favor.
Mr. Ellis.
Against.
Mr. Cram.
Against.
Mrs. Goodrich.
Against.
Mr. Holbach.
Against.
Monsieur Garron.
Pour.
Mr. Davies.
Pour.
Yeas pour 7, nays contre 4, 4.
Vote is carried. That brings us to vote 1B under Canadian Institute of Health Research. Shall vote 1B carry?
On division.
On division. Is that acceptable? It's carried on division. Vote 5B under Canadian Institutes of Health Research. Shall it carry?
On division.
Carried on division. Shall vote 1B under the Department of Health carry?
On division.
Agreed. Carried on division. Shall vote 10B under Department of Health carry? Carried on division. Shall vote 1B under Public Health Agency of Canada carry? Carried on division. Shall vote 5B under Public Health Agency of Canada carry? Carried on division. Shall vote 10B under Public Health Agency of Canada carry? Carried on division. Shall I report the supplementary estimates B to the House? Yes. Carried. Is it the will of the committee to adjourn the meeting?
Excuse me, Mr. Chair, are we not having a meeting on Thursday? Is that true?
I received a text during this meeting indicating that the whips had agreed that the Health Committee on Thursday will be canceled. So, yes, that's the information I have as well. So,
Since we're not adjourned yet, does that mean there might be time for private members' business on Tuesday next week?
I'm in the hands of the committee. Certainly, Ms. Robinato is ready to present. So we do have the report to finish, but we have two pieces of private members' business that we need to deal with as well because they've been referred by the House. Mr. Ellis.
Thank you, Chair. And certainly, I mean, we've been at this report forever. My suggestion is, if we really believe that there is a healthcare crisis in this country, then we need to get it. We need to get that report out before we start looking at private members' business. It's my 2 cents worth. Thank you.
And that was otherwise the plan for Thursday was to continue with the report. So once again, I'm in the hands of the committee on that. But I would say unless there appears to be consensus, we'll continue on with the report. Mr. Davies?
Yeah, and I would just point out that we also have the Children's Health Study, so we already have 2 open files.
Yeah.
I would rather work on those before we open a third one on private members' business.
Okay. Mr. Johari?
Mr. Chair, if I may suggest, I believe we are very close to the conclusion of the report. And if we just, as a matter of planning, agree to be in a position that once we've completed the plan, if there's time left, about an hour be dedicated to the private member motions, at least one of them, and then we move on to the other studies on the Thursday following. Just from a planning point of view, that's all. Thank you.
Ms. Goodrich, I just want to consult with the clerk on one thing. I think if we leave the private member's business in abeyance long enough that it's deemed reported back to the House, so I just need to consult on that first, because I think if there is a deadline, you need to know it. Ms. Goodrich, go ahead. It appears that we're not mandated to deal with it before Christmas, as much as that might be the will of the committee and certainly the will of the sponsors of the bills. But Ms. Goodrich, you have the floor.
Thank you, Mr. Chair, and I appreciate the suggestions from my colleagues to try and fit it in so that we can get as much in as possible, but I think that you are putting the cart before the horse if we do it that way. I think that specifically the bill on firefighters' cancer is something that deserves to have witnesses come before so that we make sure that this is set up properly. As the Member of Parliament for Fort McMurray Cold Lake, firefighters in my community saw what was an entire lifetime worth of exposure to many of these carcinogens in a month's time. And so I think that it is incumbent on us not to try and rush through this just to rubber stamp it. And I think this is a critically important bill. So this is not about being obstructionist. This is about making sure we are doing our due diligence as parliamentarians to ensure that the best possible legislation is going forward. And knowing that we do not have a deadline of the Christmas break ahead of us, I think let's plan for success rather than try and just jam everything in.
Okay, thank you, Ms. Goodrich. I'm going to come to you, Mr. Davies and Mr. Van Coverton.
Thanks.
So just first, the deadline is 60 sitting days from when it was referred to the House. So with the two private members' bills, that takes us into January, late January, early February. We can request a 30-day extension. So we are looking at, if we don't get it done before Christmas, we are looking at fairly soon in the new year. And if we're talking about several meetings with witnesses, it's something that needs to be on our radar, albeit perhaps not immediately. Mr. Davies and then Mr. Van Coverton.
Well, might I suggest that it might even be an incentive for us to finish the report. I'd like to finish the report, and then I'm okay with going to Ms. Ramanato's bill. I personally think the bill should pass very quickly. I'm not adverse to hearing from witnesses, but I support it. And so, because the Children's Health Study is something that we can schedule at our own pace. The other two matters, I think, are more pressing. So I would hope that we can get through the report in the next 2 or 3 meetings. And I want to take a moment just to ask the analysts, again, I would really like to have a clean copy of the report that contains all of the amendments up to date, and maybe highlighted what's been parked so that we can most officially come back to it and get through that. But I think we're close to coming to the end of the recommendations. Then we just have to go back to the body of the report and clean up some of the places we parked. So let's get that done and then proceed to Ms. Ramanato's bill.
Okay. Mr. Davies, my understanding that everyone has received a version of the report that has all of the changes incorporated up to November the 2nd, but I'll let the analysts speak to that.
Yeah, that has been circulated. I believe it was sent Friday afternoon, so it should be in your inboxes, and we're happy to answer questions if you have any.
Mr. Van Coverton?
Thank you, Mr. Chair. I agree wholeheartedly that we need to get to the end point of this of the report on human resources and healthcare, and I also think that if we are mutually, collectively committed to that end, then it's very, very achievable in the next couple of meetings. I just do want to point out there's been a considerable amount of filibustering and obstruction on that one, and it's extremely, extremely incumbent upon all of us to get it done. So I totally appreciate that. Maybe cart before the horse, but if we're mutually committed to getting it done, then let's act like it.
Ms. Goodrich?
Thank you, Mr. Chair. I would like to move a motion that we ask for an extension for 30 days for the two private members' bills, just so that we have some breathing space when we come back from the Christmas break. Whether we need it or not, I don't think is something that we need to necessarily discuss, but let's just ask for it in advance. With unanimous consent, we can do anything.
Surely you could agree to that.
I'm just asking for the extension so that we don't have to come back the first meeting in January to do it.
I've been working with Sherry to try to get this through. She really wants to get through before Christmas. I know our firefighters would too. I don't think we
Okay,
need a
so
lot of
there's a
witnesses.
motion
so
on the floor to,
my perspective is we don't need an extension.
to request, is it a request? Yeah. There's a motion on the floor to request an extension of time for the consideration of bills C-252 and C-224, and the motion is in order. The debate is on the motion. Mr. Davies.
Mr. Chair, I just want to clarify, I didn't quite hear from the clerk through you. Are you saying if the bill is, if we didn't pass within 60 sitting days, it would automatically be deemed passed and referred back to the House?
Correct.
Okay, thanks.
I see no debate. We're ready for the question to, the question, are we in favor of requesting a 30-day extension for the consideration of bills C-252 and C-224 before the committee? All those in favor, raise your right hand, please. Opposed? The motion is carried. Is it the will of the committee to adjourn the meeting? I see consensus. The meeting's adjourned.